Today I have the honor of speaking with Dr. Asha Bala. She's our cataract, cornea, and refractive surgeon certified ophthalmologist that works with our partners at DLV. She was a director of cornea and refractive surgery service and associate professor of ophthalmology at the University of Louisville. She does all types of refractive surgery, as well as cataract surgery, premium IOL implantation. And she holds several certifications, including the femtosecond laser platforms and performing cataract surgery. Dr. Bala is a overly highly qualified partner at DLV. Since she came on board, we've been extremely pleased with all of her surgical outcomes, and just wanted to provide an opportunity for her to kind of share her experience and wisdom in the field of LASIK surgery. And so we're going to kind of do this in a little Q&A session where we'll be asking her some questions that are commonly asked by most patients, and she'll be able to kind of give us some feedback as well. So welcome, Dr. Bala. Thank you so much for your time. And
Thank you so much, Dr. Trin.
Dr. Bala, the first question is, what is LASIK?
So LASIK is, I feel it's kind of an umbrella term for, in general, for our patients in terms of thinking about refractive surgeries. With laser vision correction, LASIK is one of many forms of that. And with laser vision correction, we're reshaping the cornea to do what the glasses and the contact lenses do. So patients don't need glasses or contacts anymore. With LASIK, we create a flap in the cornea, we lift it, which you can see in the picture here. We apply a treatment and lay the flap back down. The flap will self-seal in about 24 to 48 hours. Vision returns at about 6 to 8 hours that day, after about 6 to 8 hours that day, and there's a big difference, of course, the next day. And then all patients will be kind of developing little subclinical stabilizations over the course of a month or so.
So how do we know who a good LASIK candidate is?
In general, LASIK candidates are 21 and over, and they should have a stable glasses or contact lens prescription. The reason for that is that we don't want to laser or try to laser a moving target. So we want to correct patients' refractive error when it is, stable and people's eyes are fully mature. We look at patients' corneal health. Do they have regular shape, adequate thickness? Do they have any signs of underlying corneal disorders where they might be a poor candidate for LASIK, i.e. if we thin the cornea with laser, they're going to develop more problems. In general, patients should have pretty healthy eyes, no other comorbidities, if you will, no other ocular conditions. And in general, for patients who are a little bit older that are seeking LASIK, we want to make sure they don't have any signs of cataract formation, because that is going to shorten the life of their LASIK, so they may be a better candidate for other forms of refractive surgery.
And is there a hard fixed age that you would say, like, 21 and over, it has to be around that range, or do you typically?
I think 21 is kind of just a ballpark for patients that have more mature, eyes. Like, we're thinking most patients have kind of grown enough and their eyes are not changing anymore. So it's a nice ballpark. I always like to say like early to mid 20s is a nice age for most people if they're considering it at that point, just so we make sure we're not changing.
Yeah, one of the most common questions that we have from patients too is that, what's the likelihood that the vision can change even after LASIK surgery if we do have stability?
That is a great question. I would say, there's always a chance that someone might need a touch up at like 10, 15 years or later. That being said, our lasers have, significantly advanced, and we are also, understanding our lasers much better, so we can adjust treatments based on patients' age and tissue remodeling. So the chance of needing a touch up is much lower than it used to be. And it is not the end of the world if someone does need a touch up after several years. That's just part of normal, remodeling of tissue. The other thing that LASIK doesn't address, especially when patients are getting LASIK in their 20s and 30s, is that it doesn't address the change in reading vision that will occur during the 40s. So people will still need reading glasses when that time comes.
Beautiful. So what kind of testing is necessary prior to surgery to ensure that, they're a good candidate?
The things that we do are, number one, we do corneal mapping that gives us kind of a more comprehensive view of the cornea so we can assess thickness and regularity. We look at patients' ocular history, their prescription, age, and expectations as well.
What do you mean by expectations?
I always like to chat with patients about what they're looking for with LASIK. Why are we seeking out LASIK? Are we wanting great distance vision for patients in their 40s and later? Are we looking at reading vision? Do we want both? That helps us to develop a plan that's going to be tailored to the patient's needs. And the other thing we always like to make sure of is that we adjust expectations to a realistic level. We want to make sure that patients are not, absolutely don't want to wear glasses for the rest of their life. LASIK is going to get us a lot, but it's not going to cure everything for the rest of time. The other thing is that if patients have any sort of history of lazy eye or anything like that, we can get their vision to the best they are capable of, but we cannot change their visual potential with LASIK.
Gotcha. So you haven't found the fountain of youth essentially yet.
Correct. We're still on the lookout. We're still on the lookout.
So that's good. So screening is really important, and you talked about like irregular cornea elements. Can you describe this picture? Tell us what we're looking at.
In this picture, we're looking, well, one, you can see kind of LASIK happening, of course, and then on the right, under this kind of purple label corneal ectasia, that is a picture of what a cornea looks like when we do not want to do LASIK. So one of the contraindications to LASIK is corneal ectasia, which is the development of an irregular cornea, kind of irregular steepening of the cornea and thinning that will lead to irregular astigmatism, which cannot be corrected with traditional glasses and contact lenses. So that is something that we definitely don't want to induce, and we also don't want to operate on someone who has a prior ectasia condition. So that is the picture that you can see there. And then, of course, anyone with any other underlying corneal disease would not be a candidate for LASIK since we are operating on the cornea. Patients with severe dry eye, also not candidates because LASIK does tend to worsen dryness. Not to mention severe dry eye would alter a prescription and make it very tough to correct it fully with LASIK. And then patients with significantly high refractive error, where we're going to be doing a lot of laser. They might not be candidates because we may be thinning their cornea out a little bit too much beyond the safety threshold. So for those patients, we may have other options of correcting their vision in a more safe way.
So what's the typical range for LASIK procedure that you would say would be considered safe, or is this very dependent?
Very dependent on patients' corneal thickness. Generally, just a ballpark, we're looking at patients up to like -8 in terms of nearsightedness, and up to like maybe +4 to +6 if they're farsighted. But it does definitely depend on how much tissue they have. And we also want to make sure that we're offering them a modality of refractive surgery that's going to get them the best quality vision they are capable of. Generally, we can correct up to 4 to 5 units of astigmatism, with the caveat that patients who have high astigmatism may need to have a retreatment at 3 months or later, depending on how they respond. We can generally fully correct it. It's just a question of how they respond to the initial treatment.
Is there a higher risk of regression for, let's say, farsightedness versus nearsightedness, or would you say it's only for astigmatism?
Patients who are getting farsighted LASIK, they do have a little higher rate of regression, so they have a little higher chance that they might need a touch-up at some point in the future. That's just because what we're doing in that process is steepening the cornea, and the tendency of the body and the way it heals in terms of the cornea is to always make things more steep. So we are kind of fighting that a little bit, so it can lead to needing a touch-up at some point.
Great. So let's say we're 21 to 40 versus 40 and up. Like, is there any difference in any kind of surgery expectations, or what we're doing or looking at?
Absolutely. In terms of patients who are 21 to 40 or so, as the slide indicates, we're looking for stability of prescription, and we want a generally healthy eye. And for these patients, LASIK, for instance, if we do LASIK and we're correcting their vision, these individuals have their accommodative abilities completely intact, so they can still achieve great reading vision, and they don't have to think about wearing reading glasses. So for them, the conversation is much different. Patients who are 40 and above, we may be considering whether they want reading vision to be more uncorrected and whether they don't want to wear reading glasses. So we're thinking of a lot of different options for them because we want to correct a range of distances. So sometimes for these patients, a lens replacement would be a better option than LASIK. The reason is that we have a variety of lens implants that we can offer them. We can go about monovision. We can correct different ranges of refractive error. So we can give them more range of vision compared to LASIK, where we can only target distance or up close.
And also with lens replacement surgery, they probably won't need cataract surgery later, right?
Exactly. And definitely it's a conversation I always like to have with patients. And that's also where the expectation discussion comes in. You know, what are they looking for? Some of the patients that I see, they really don't care about wearing reading glasses. They just want the distance corrected. And beyond that expectation, they're great LASIK candidates. So as long as we're all on the same page, that's a good option. And then I have other patients that are kind of thinking about the long term, and they want all the ranges of vision to be at least corrected to some functional level. So this kind of offers them, the lens replacement surgery offers them that option.
Is there a cutoff where you would say like, hey, let's not do LASIK, let's consider lens replacement surgery more, earnestly?
When I'm talking to patients in their late 40s, it definitely comes up, and patients over 50, it almost always is my procedure of choice.
Perfect. Otherwise, you kind of have two surgeries and
Exactly.
time period.
Exactly. I'd rather be a one-stop shop for them.
Yeah. What advancements have occurred with LASIK surgery?
A lot has changed over the past decade, or even, honestly, 20 years. We've developed a lot of nomograms and calculators that allow us to promote more accurate treatments. Plug patients' prescriptions into different calculators and come up with a treatment plan that will account for tissue remodeling and their age. So that gives them longevity in terms of their LASIK treatment. So it reduces the risk of touch-ups. And the lasers themselves have really gone through remarkable advancement. The treatments are faster. There's pupil tracking and iris landmark registration. And essentially what that means is that we're taking landmarks on the eye. We take pictures before surgery, and then the laser uses those landmarks to maintain centration of the eye. So not only am I watching and making sure that a patient is centered on the laser, but the laser itself is also doing that. And we can also correct a wider range of refractive error than we used to, such as the astigmatism, which you and I discussed earlier.
So a lot of our patients, like if you don't look in the right place, is your laser surgery going to be botched?
That is a really good question. I definitely get asked that as well. And no. No, because the lasers even before are programmed to stop immediately, even if the pupil deviates a certain amount away from the center. Not to mention, I at least personally am always watching patients and gently kind of holding their head and keeping them in line. So patients can't botch their surgery really on that front. There's a lot of corrective mechanisms.
So are all lasers the same? Because I mean, like we've had a lot of progression from the LASIK technology where it used to be just a blade to create the flap, and now there's all these different types of lasers. Like, how does somebody know what's the right laser for them?
Very good question. Whenever we do our initial consultations with patients and then on the pre-op exam, we do get a sense of their refractive error, and it does help guide us in terms of our laser options. As you can see here, there's the Allegretto and there's also the NIDEC. The Allegretto can correct almost any refractive error, so it makes it a very flexible laser, and it does optimize the risk of glare and halos by being wavefront optimized. As I was saying, the NIDEC also does a great job at correcting for glare and halos by kind of looking at patients' corneal maps and correcting for irregularities there. However, it is a little bit more limited in terms of the prescriptions that it can treat. It can treat myopia or nearsightedness, and it can also correct nearsightedness associated with certain levels of astigmatism. So that though it's narrow, it's also a great laser that does a great job as well. And we always will look at that with patients and see which one might make more sense. And for both of these, I recommend an all laser procedure. So a laser to create the flap and a laser to apply the treatment. So it's bladeless.
Yeah, I think with the blades, we tend to see a little bit more debris in the flaps. Have you ever done that, or have you seen that before? Or?
I've definitely, the blades can be associated a little bit more with that, just simply because of the mechanism. With the femtosecond laser created one, it's very minimal to have that, or very unusual.
Yeah, it's amazing. After like a year or two, sometimes it's hard to even find the edge of the flap. So it looks great.
Right.
So what can a patient expect after laser vision therapy surgery?
So after LASIK, the recovery is pretty rapid, as you can see here. Initially, you feel a little bit underwater. Most patients feel underwater just because their corneas are settling into place. I generally recommend taking a nice long 6-hour nap after surgery, which is really not difficult because we do give a little oral anti-anxiety medication. So it makes a nap very easy to accomplish. Once you wake up from your nap, the vision does generally start sharpening up at about 6 to 8 hours, and there's a big difference the next day. But usually if you've had surgery, for instance, in the morning, and by the evening, you'll probably be seeing things even on the TV.
And it's pretty common to have like some dryness or glare or anything at all after the surgery.
Absolutely. Most people feel a little bit sandy gritty. And in the first week or few weeks, you might feel a little bit of dryness. Nothing some artificial tears can't correct or improve. But that's the most common thing that people notice. And you will notice a little bit of glare and halo after surgery. And with refractive surgery, that's kind of part and parcel of the whole of the thing. Most patients should not have debilitating glare and halos. If they have higher prescriptions that need longer laser treatments, or if they have larger than average pupils, that tends to increase the risk of glare and halos after surgery.
Yeah. Why LASIK instead of another procedure like PRK or lens exchange, or are they not necessarily mutually exclusive?
Correct. Sometimes patients are candidates for all of them. So it's just a question of figuring out what works for a certain person. PRK is a surface ablation form of LASIK. So we apply the laser vision correction without creating a flap. We just remove the front surface of the cornea and apply the treatment. So as you can imagine, there's a little bit more healing involved, so the front surface can regenerate. It's a longer visual recovery, and it's cause a little bit more post-op discomfort. The visual outcome is eventually going to be the same. It's just a little bit of a longer road to get there. I generally reserve this for patients who are not great LASIK candidates, but they're still eligible for laser vision correction. The lens exchange procedure, as we've discussed, it is correcting the refractive error from the lens rather than by reshaping the cornea. So I generally recommend considering that for patients in their mid-40s and onward, or patients who are interested in refractive surgery but have developed like early cataracts.
Awesome. And then, so you said that PRK is probably more geared towards patients, though. Do you tend to use these for higher myopes or higher nearsighted patients?
Sometimes if patients are going to be, losing a lot more tissue, I'd rather do the treatment at a little more superficial layer of the cornea, which PRK lets us do. So that is sometimes an option, definitely.
What's a typical like heal time, would you say, for a patient for, full visual recovery?
Most patients will start, the first week, there's a lot of healing. So at 1 week, people might be able to see better. But the end point is probably more reached at like 4 to 6 weeks.
Awesome. So what risks are involved with LASIK surgery? Basically, every one of our patients really values their sight, and for good reason. It's the most valuable sense. So, undergoing elective surgery is always a little bit scary. I mean, what can we do to mitigate those risks? And, what do you think about the risks themselves?
Generally, the risks include dryness. The ones to highlight are dryness in the eyes, like we had mentioned. People do tend to notice a little aggravation there after surgery. Generally, artificial tears will improve that. The nighttime glare and halos, and of course, the possible need for an enhancement, given that everyone responds to the laser energy differently. Also to remember that this doesn't address other eye conditions such as cataracts or glaucoma or retinal issues. So we can really only improve patients' vision to their best potential. We can't improve their vision past a limited potential due to other ocular issues, such as lazy eye or strabismus or any of the other things that we've mentioned. But those are the main ones I like to highlight for patients.
So what happens during the procedure itself?
So on the day of surgery, patients will come in, or prior to surgery, of course, there's a pre-op evaluation, which usually you do, and I will, just double check a few things on the day of surgery. The point of that evaluation is to check the refraction, both undilated and dilated, and to assess the health of the eye and make sure that we're still good to proceed. And then on the day of surgery, patients come in, We give you a little bit of anti-anxiety medication. Prior to that, we usually will check your prescription. We make sure you're comfortable, and then we take you to the laser room. And once you're in the laser room, the surgical team will, position you on the bed and make sure you're comfortable. You usually get a blanket. You might even get a little stuffed animal to hold on to. And then for LASIK, there are 2 laser treatments, one that creates the flap, and then we move you over to apply the treatment with another laser. For PRK, it's just 1 laser treatment since we don't create a flap. During that time, you'll be asked to focus on a light during the procedure as best as you can. And then I also ask patients usually to make small movements if you are asked to move your eye. It is a painless procedure. You should not feel any pain. You may feel some pressure sensation in and around the eye during flap creation and LASIK, but beyond that, like, everything should be painless. Generally, it takes about 5 minutes an eye. And as we mentioned before, best thing you can just do is go home and take a nap. And after LASIK, you will be asked to use drops for about a week following the procedure. For PRK surgery, you will be on drops for about a month after the procedure.
So is there anything that they should try to avoid right after the surgery, or?
I recommend, kind of being mindful in the first 7 to 10 days, especially after LASIK, because the flap is settling into place. You can get back to most activities. The things that I don't recommend doing are things like hot yoga, ocean water exposure, water sports, jacuzzis, hot tubs, swimming pools, for the first few weafeeks after surgery. And patients of mine that are big surfers or, ocean goers, I usually recommend wearing wide-rimmed goggles when they return to that after the month, and using that for the first few months after surgery.
And then can most patients go back to work pretty much the next day or a couple of days afterwards?
Yeah, depending on the line of work, of course, but most patients just get to go the next day.
Perfect. So what happens after we just talked about that. Yep. What if my vision is not as good as I expected?
If that were to happen, we have to first assess what is going on. Usually that might be because there is some uncorrected refractive error. And in that case, we would end up doing a little touch-up. And I usually explain this to patients as, you are your own individual. And so you absorb the laser energy different to the average person. And so we obviously plug the prescription into a lot of different algorithms and nomograms and then generate our treatment plan. But again, it is based on a population average. So if someone needs a little bit of extra laser energy to achieve their best corrected vision, that can always be done. It's not the end of the world. And we generally can do that at 3 months or later.
Perfect. So is LASIK the right procedure for me or for the patient?
Definitely. I mean, I think that LASIK is definitely kind of a gateway into refractive surgery because it is what people hear about, all the time. If you are a good candidate and you are interested in doing it, it's a great surgery. It can be life-changing. I tell all of my patients that if they are not good LASIK candidates, I have to be upfront with them because otherwise I'm setting them up for failure and me up for failure. And I don't like to fail, and I'm sure nobody else does. So we have to be very careful in how we choose candidates for LASIK, and we have to be very honest with our patients and transparent. And if for some reason LASIK isn't an option, the great thing is that there are other options, and we can always offer that, based on what's going on with each case.
So it's basically really kind of making sure the expectations kind of match what we can deliver and making sure they're good candidates, right?
Exactly.
Yeah, beautiful.
Exactly.
Thank you so much for your time, Dr. Bala. And, if any of our participants or attendees have any questions, feel free to let us know. If we can't get the questions here right away, we can always reach out to Dr. Bala and we can communicate.